Good afternoon, everyone. I'm Joanne Starks of SEDL or CEDL in Austin, Texas, and I will be moderating today's webcast on developing the knowledge translation plan to build research impact. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, which is funded by the National Institute on Disability and Rehabilitation Research, NIDR, in the U.S. Department of Education. I want to thank my colleague Ann Williams, our webinar administrator, for her logistical and technical support for today's webcast. A reminder that we will ask you to complete a brief evaluation at the end of the webcast. I'll give you more instructions following the presentation. And remember that you can download a copy of the presentation materials from the KTDRR's website at www.ktdrr.org. The Center on KTDRR is working with a number of national and international partners, and we are pleased that Dr. Melanie Barwick is among the KT experts who are working with us. In today's webcast, she will discuss developing a KT plan in order to increase the impact and reach of research findings to a variety of knowledge users. She will review the state of the scientific evidence for KT strategies and introduce the Knowledge Translation Planning Template, a tool that can assist with the planning process. This webcast is offered in preparation for the upcoming online conference on KT measurement scheduled for October 29 through 31st, 2013. It gives participants a good foundation in KT planning ahead of Dr. Barwick's conference session. Now I'd like to introduce our speaker. Melanie Barwick, PhD, is a registered psychologist and senior associate scientist at the Hospital for Sick Children in Toronto, Canada. She is Scientific Director of Knowledge Translation within the Child Health Evaluative Sciences Program. Her program of research in implementation science and knowledge translation explores empirically supported approaches, measures, and tools to support the implementation of evidence-based practices in mental health, education, health, and global health contexts. You can visit her website at www.melaniebarwick.com. Dr. Barwick holds appointments as Associate Professor in the Department of Psychiatry and the Dalla Lana School of Public Health at the University of Toronto. She also leads a technical support team for 107 service provider organizations using the Child and Adolescent Functional Assessment Scale, supporting Ontario's Outcome Measurement Initiative for Children's Mental Health for the Ministry of Child and Youth Services. She provides professional development in knowledge translation internationally through the Scientist Knowledge Translation Training for researchers and the Knowledge Translation Professional Certificate for KT practitioners. She consults to government and service providers in the child and youth mental health, education, and health sectors. I'm now going to hand things over to Dr. Melanie Barwick to start today's presentation. Melanie?
Thank you, Joanne, and good morning, everybody. It's really a pleasure to be doing this webcast for CEDL and to take you through what we have been doing here at the Hospital for Sick Children with regards to building a template for helping researchers and those working in the community to build a knowledge translation plan. So let's get started. So why would one want to consider building a knowledge translation plan? In Canada, the context might be a little bit different than in the United States, but for several years now, our national health funder, the Canadian Institutes for Health Research, has asked researchers to include with their research proposals some element of what the value add might be of the research that they're proposing. And this often comes in the form of a knowledge translation plan. This is to say, we are asking researchers to consider who might be using the results of your research, what might the impacts of your research mean for people in the community. And as many of the people watching this webcast can attest to, we as researchers have done an awful lot with respect to how we communicate to other scientists. And it's only in the last several years that we have been really pushed to think about what the implications of our science might be for other knowledge users. So decision makers, policymakers in government or in organizations, volunteer health sector, the public, consumers of health and mental health services, and the like. When Canada began to direct researchers in this way, many people came to us and said, well, we don't really know what a knowledge translation plan is, nor do we know how to even begin to put one together. And so the work that we pull together here that I'll be sharing takes you through a template that will help you conceptualize the knowledge translation plan for a research project or for a project. And so it is becoming a requirement for many research funders. And if we don't plan for it, it won't happen. Probably common to the context in the United States and Canada is that our research funding dollars are diminishing. When we are successful for research funding, oftentimes our budgets are cut somewhat. So the first thing to go is not the science, but rather what are we going to do with the science once we've completed our project. We also know that if we have a clear plan going into developing our research, that we can be more effective and more efficient in how we share that research at the end. So being planful and having an idea of what we will do for knowledge translation right from the get-go at the beginning of conceptualizing the research project is a good idea. We know for some time that the scholarly indicators of success and scholarship in academia have really relied greatly on the number of publications, where those publications sit, how many grants we get. But in the end, none of that really does very much for impacting the world around us. It sits on our CVs, our papers sit on a shelf or in a journal, and it might be dismaying to come to terms with the fact, but it is actually well known that not many people access journals. We do as researchers, but in terms of their accessibility, whether it's open or not open to the general public, it is very low. And so we need to be thinking about other means to get our knowledge out to a variety of different people. And we owe those people because these are taxpayers who pay our grants, essentially. And so we need to be accountable for these public funds. The funders themselves want to demonstrate return on investment for the research that they're funding, and so do we. Many of us in health, behavioral health care, mental health, have an interest in improving the world around us, improving the well-being of those with whom we work, conditions that we study. So we very much are invested in having an impact. And knowledge translation is in part not just how you share the research knowledge that you have, but how you connect, how you collaborate, and how you can find indicators of the impacts of your research work and track those over time. Our organizations that we're working in are also interested in tracking impacts for the research that's conducted within their walls, and so it's a consideration all around. We want to advance science, we want to advance practice, and so that means getting what we know works to improve health and well-being into the hands of people who can apply it. So let's consider for a moment the key components of a knowledge translation plan. This is something that very many people often skip, and it's never good when you skip the first essential piece of a process. And this is really to ask yourself, maybe you're sitting on your own and you're thinking of a knowledge translation plan for your research, or you're sitting with a research team, a group of people that you work with on a project. The idea really needs to be discussed here is, what are your KT goals? What I mean here is, at the end of the day, when you know what you have learned in your project, in your research, what you want to share with a variety of different people, ask yourself, why are we sharing this information? Are we sharing this information because we want to share what we know, state of the moment information on a particular topic? Are we wanting to share information to build awareness in a particular knowledge user group? Do we want to share because we have an intention of leveraging practice change or behavior change or change in policy? So to be really clear at the get-go, what are your KT goals for the activities that you are going to engage in? This relates also to who your target audiences are. We call them knowledge users here, and that's a really nice term because stakeholders has a little bit of a different connotation, I find. So let's go with knowledge users. And here you're asking yourself, who out there in the big wide world is going to be interested in the research findings? We have a tendency sometimes to have some tunnel vision around knowledge users, same old, groups of people that we have interacted with over a period of time. But this is a moment to reflect and discuss in your research team, are we missing anybody? Is there anybody out there for whom this research knowledge will be valuable in some way? And how are you going to engage those knowledge users? This is important to think about because we have been able to determine that the earlier you engage your knowledge users, the better. And what I mean here is when you can pull in people who have a stake in the work that you're doing, who are going to be the recipients of your research knowledge, if you pull them in early, you have an opportunity to benefit from their experience, from their expertise, from their perspective. You have an opportunity to benefit from their having a voice in the research questions that you're asking, their input into research methodology. Oftentimes that could save you from going down a pathway that is going to be a bit futile. You get people who are very knowledgeable about your audience, and they, at the end of the day, can give you access to a group of people who you want to share your research knowledge with. And that's important because the credibility and access of the messenger, if you will, is an important component of knowledge translation and good communication. So think about how you're going to engage them and think about when you're going to engage them. A story I often tell when I talk about the KT planning template harkens back to the days where we had a injury prevention organization here at the Hospital for Sick Children called Safe Kids International. And in the day, Safe Kids International was doing quite a lot of work in the prevention of scalding in young children. And 10, 15 years of research culminated in understanding that we certainly could prevent the prevalence of scalds in young children by having the public, people in their homes, turn down the thermostat on their water heaters. And so they mounted a public media campaign to get people to be aware of this problem and to encourage them to change their behavior, if you will, by actually changing the temperature on the thermostats of their water heaters. Another strategy for Safe Kids Canada at the time was to reach out to the Plumbers Union because the thinking was that, well, plumbers are people who are in people's homes. This is what they do. We could perhaps enlist them to do this for families, to educate families about the proper temperature for water heaters and to actually turn down the temperature for water heaters. And so the executive of Safe Kids Canada reached out to the Plumbers Union. And interestingly, and the story was recounted to me by the former executive director of Safe Kids, and she said, you know, we were really surprised that they weren't all that receptive. This is for us where we really had an aha moment, and we learned that, you know, the moment at which you engage your knowledge users is really critical because people want to feel involved in the process of discovery, involved in the process of interpretation of what's been discovered, and they are therefore more conducive and receptive to being involved in the application of the research findings. And so, you know, in the sort of analysis of what went on, they determined that they really needed to have reached out to this particular knowledge user group earlier on to really make them feel as though they were part of the process. So consider when you will engage your knowledge users. Also consider what your main messages are going to be. And I think of main messages as sort of two buckets. I think of SMIT's, single most important things. And if you sit down with your team and you think, okay, you can actually do this prospectively or you can do it retrospectively. Of course, prospectively, you are hedging your bets as to what you think you're going to discover. And if you're writing a plan for research funding purposes, you may want to be very clear about how you are going to work together to come up with your main messages and how that will be collaborative, but that, of course, the main messages remain to be determined as a function of the research that's yet to be conducted. If you're doing this retrospectively, you want to ask yourselves, what did we really learn here? What would I say is the single most important thing? The other bucket of main message I call BLAMs, so bottom line actionable messages. And sometimes we do have actionable messages. Sometimes we don't. So consider what your main messages are, and very specifically consider what your main messages are for different knowledge user groups. I may conduct research that has implications for parents, for children, for teachers, for decision makers, and whilst I'm not going to have different findings for those knowledge user groups, I may want to frame my research findings, my SMITs or my BLAMs, in different ways so that I am addressing their particular needs, what they really want to know from the research project, and I can also shape my messages using channels of communication that meet the preferences of my knowledge user groups. And then you need to consider, well, what knowledge translation strategies will you use to convey these main messages to knowledge users in order to address the KT goals that you have identified. And we're going to go through some of those knowledge translation strategies in a moment. How will you implement those strategies? So oftentimes we get very excited about a particular strategy. Perhaps it's a webinar or a webcast such as this, where you're informing a particular knowledge user group. Perhaps it's a clinical practice guideline, and we develop our guideline on the basis of the research that we've conducted. One then needs to sit back and consider, how is that guideline going to be implemented? I've produced something which is a distillation of research knowledge that can be used by a particular knowledge user group, and I'm handing it over in a format that is an acceptable format as a KT strategy. But much more work needs to be done in how to implement those guidelines in a particular context or setting. So we need to think about implementation as something a little bit different than knowledge translation. With what impact? And here this is one of the common misses or things that people leave out of their knowledge translation plans, is that they never circle back to ask, did my knowledge translation strategy actually accomplish my knowledge translation goal? So with every implementation of a KT plan and KT strategies, we have an opportunity to evaluate whether that strategy actually was successful in achieving that knowledge translation goal for that particular audience. And in doing so, it is a little bit of extra work, granted, but now you have an opportunity to make a contribution to knowledge translation literature in terms of KT strategies, their effectiveness for particular knowledge groups and in achieving particular knowledge translation goals. But you also have very good practical information about what knowledge translation strategies you're going to invest in the next time you mount a project or a research activity. Was it worthwhile to write a KT casebook? Was it worthwhile to reach out to knowledge users with a webinar? Did we accomplish what we wanted to accomplish? Were the reminders that we developed or the one-page summaries that we distributed useful in achieving our KT goal, whatever that might be? So what I want you to take away from this as a main message from this webcast is KT planning is not a linear process. To be done really effectively, you need to circle back and ask yourselves, did we actually accomplish what we set out to accomplish? And then we need to, of course, think about what resources are required, the budget, the staffing, the materials we may need to implement our KT strategy. That's also an important consideration. So let's talk a little bit about identifying your KT goals. Here are some of the KT goals that might be applicable to your context. Sometimes we really just want to generate awareness or interest. This is the first step to move people from perhaps pre-contemplative to a contemplative understanding that there is an issue at hand, gather people's attention on a particular issue or solution, strategy, resource, and that's a valid knowledge translation goal. Depending on what resources you might see in the web offered by different organizations, there may be a tendency to think that knowledge translation is just about changing practice or behavior or policy. And at SickKids, we have a larger view of knowledge translation, beginning with this very first stage of generating awareness and interest. You might simply want to share knowledge for the sake of sharing knowledge. This is what we know now about this particular issue. These are limitations of what we know. We're not asking you to act on this knowledge at this point because it's early days, but here's what we know. And that's a valid thing. When you consider that probably the penultimate, most common knowledge translation strategy is a journal article is really sharing knowledge. It's not set out to inform people about what steps they need to take to change their practice or behavior or what policymakers might do. It's simply, here's the problem, here's what we did, here's what we learned, and here are the implications. And we use this to inform future research. So indeed, this is a common knowledge translation strategy for most researchers. There are times where what we have learned positions us in the right place at the right time to generate practice change for practitioners or behavior change for the general public. And if we have sufficient rigorous knowledge, research knowledge, and evidence, then that might be a very valid KT goal. Similarly, when we are setting out to generate policy action as a result of our findings, we also want to be sure that we have good evidence from rigorous research to back up our request for policy action. We may want to mobilize the public to think or behave differently, and for some research projects, they might be culminating in a commercialization project or a patent, and that is also a knowledge translation goal. And thinking about who your audience is, just to reiterate a little bit here, you want to be thinking about who out there needs to hear your message, and press yourselves to have a conversation about whether you're leaving out any key knowledge user audiences. The other thing to think about is how well do you know their preferences and their needs? And by this I mean, is this a group of people who tend to go to the web for information? Is this a group of people or a particular audience that likes to get their information and their knowledge from those around them, face-to-face, personal contact? In some of the research work that we've done here, where we've looked at the teacher preferences for evidence-based knowledge, one of the things that we learned when we talked to teachers was that they were much more influenced by the teacher down the hall in a classroom in terms of whether a particular practice was leading to school success for the students in that classroom than they were by what our Ministry of Education had to say, what the research base had to say. And so for them, it was really teacher-to-teacher contact that was meaningful. That's an important thing to know if you want to reach teachers. Think about how receptive they're going to be to your message. And again, this harkens back to my earlier point about involving knowledge users in some way, shape, or form in the conceptualization of your research project. And in fact, that's become quite important here in the Canadian context, where the Canadian Institutes for Health Research have developed certain research competitions that actually ask you to identify a primary investigator and a primary knowledge user as a co-applicant. Here, trying to really scaffold researchers into behaviors that are very engaging and collaborative right from the get-go. And knowing things about your audiences, how they like to receive information, what sorts of modalities are they most interested in. You also are looking to identify particular barriers to action. Are there things in the context around them that are going to impede or inhibit their ability to act on the research knowledge or to even be aware that this research knowledge is in existence? So it's a little bit more groundwork than probably most researchers are used to doing in terms of thinking through KT planning, thinking through your knowledge user audiences, perhaps reaching out to them in advance of submitting your research funding application, and really just getting to know them, what they're all about, what sorts of research questions do they have that you can weave into your particular discovery-based research questions. Keeping in mind that non-academic folks who are out there in the world are contending with different hassles and worries and concerns that perhaps we have the privilege of seeing from where we sit as researchers. So who might these knowledge users be? Well, consumers of service, health practitioners, managers in a workplace, in a hospital, policymakers, maybe the general public is who you have in mind, patients, media, as a vehicle to get your information out to the general public. There are some researchers who have private industry as sort of one of their key knowledge users because they have a commercialization pathway in mind, perhaps. Advocacy groups, research funders can often be participants and knowledge users, decision makers, and of course, other research scientists. And maybe we've left something out there, so as you'll see on the template, there is room for identifying another knowledge user audience that we've left out. So as you're discussing this with your team and you're starting to reflect on your knowledge translation plan, consider how to involve your knowledge users in the project development, in its interpretation, in discussing preliminary findings and your findings, and in thinking through what your knowledge translation activities will be. One of the things I often point out when I teach about the KT planning template is that it's very valid and probably a good useful strategy to identify some research partners strategically simply on the basis of what they can lend to your knowledge translation activities. Some of the research work I've done here with Dr. Bonnie Stevens in pain management and pain assessment in pediatric hospitals, we have, I think, really leveraged our KT planning by involving the Canadian Association of Pediatric Health Centers to help us reach out to knowledge users in other pediatric hospitals across Canada rather. And they've helped us also because they already have in place webinar technology. They have good credibility with the hospitals, so they have the means, they have the contact, they have the relationship already built. And for us as a research team, that was a nice strategic win in bringing them on board to our larger partnership so that they could help us realize our knowledge translation goals. Think about what information the knowledge users need rather than what you think they need. So this is keeping in mind that we often have a different perspective because of where we sit as researchers than do our knowledge users. What is their perspective, and involving them gives them that voice so that you can broaden your understanding of what perhaps they may gain from your research activities. Think about how to tailor main messages and KT strategies to their preferences for format, timeliness, and functionality. Do people want face-to-face? Do they want to go to the web? Do they want group learning? Do they want one-page summaries? What's going to lend itself best to reaching your KT goal? Many people are very attracted to the virtual formats that exist and the huge opportunities for spread and ease of dissemination, low cost, through the web. and the interactivity that comes with the web. Depending on what it is you want to accomplish, I guess I would just caution that if you want to interact with a group of people on an ongoing basis, some face-to-face, particularly with groups of professionals, really serves to set the stage and give people a comfort level and build some trust before you then begin to rely on virtual communication. So let me just be specific and give you an example. Many instances in healthcare we're looking at, and also in education, we're looking at developing communities of interest or communities of practice. And of course, because not everybody is geographically close, we go to the web as an opportunity to connect people who might be far distances from one another, but who want to share information on a particular topic and want to learn together and support one another. If you can, I would say try and bring face-to-face groups in geographic jurisdictions together to start to build a greater sense of community before relying solely on the virtual format. That's just been my experience. And as I mentioned earlier as well, you need to think about the perceived credibility of the messenger in this case. Think on your research team, and by research team I mean broadly defined, not just the primary and co-investigators, but the people that you've pulled in, the knowledge user groups. Who's going to reach out to which audiences? Who's a credible messenger for those audiences? It's not always the primary investigator. So think about all of the formats for communication that we have at hand, in addition to journals that reach out primarily to other research scientists, newsletters, F2F stands for face-to-face in my shorthand. Are there opportunities for public messages on television or radio? Using the newspapers, one way to think about the newspapers in most large cities, and maybe even smaller cities, have journalists who take a particular interest in health stories. Who are those journalists? Reach out to them, build some professional linkages with them and some professional relationships, and when you have something to share, you have that basis and you can use that channel. Conferences and presentations, of course, are still within the purview of our formats for communication. Wide range of strategies through the web, including infographics, including videos, all sorts of things, toolkits, that information that can be made available, and then the use of networks and communities of practice. So there is a wide range of formats for communicating your main messages. We're often also asked, typically by funders and sometimes within organizations in which we work, to write reports about our research projects. And you know, a lot of these reports, it's hard to bring them to life and make them engaging and something people want to pick up and flip through. So always consider making it look attractive. But when forced to do a report, one of the formats that we've always liked is one that comes from the Canadian Health Services Research Foundation and is sort of what I call the 1-3-25 format. And the first page is really your main messages in bullet point format. Boom, boom, boom. What are your single most important things? What are your bottom line actionable messages? Think about what are the lessons that the knowledge users can take away from the research? What are the implications? And really what you're asking yourself here is, here's what we learned, so what? What is the pinnacle piece here? And if possible, provide actionable messages, so recommendations for practice or policy. That might not always be the case, depending on your research, but if it is, make sure you make them actionable, not just recommendations that are pie in the sky. 3 pages for an executive summary, and you know, just nice paragraphs, condensed information. Lead with the most interesting aspect of your research, a little bit about what you did, and a lot less than researchers tend to like on the methods and the specific details. You can link to additional files, to journal articles, to things that are available to provide that level of detail for people who need it. So it's not an academic abstract. This is plain language writing at its best. And then 25 pages or so, sometimes that's a challenge, for the report that you're writing. Try not to revert to academic prose, and this is a toughie. One of the things you might want to consider if you have considerable knowledge translation activities in your research project is to put aside some budget for a plain language writer, somebody who can take a look at your writing and turn it into something that's a little bit more easy and palatable for the non-academic to read. Consider using headings about the context, your implications, your approach, your results, and so on. So this is a nice strategy when you have to do a report. Another thing we consider about sort of knowledge user engagement is the times at which we can engage our knowledge user. And I've spoken about this a little bit already. We typically are end-of-grant KTers, if I can put it that way. We like to do dissemination and communication of our research findings when we've finished the study and it's all wrapped up. And we tend to do these in the traditional academic ways, which is to say conferences and rounds if we are in medical settings, and certainly journal publications. When you do knowledge translation that's more integrated, we call that integrated knowledge translation. So this is involving your knowledge users early on throughout the research process as you work collaboratively to shape your research process. And they can help you with different things that can often be very valuable in terms of your time, but also lead to greater impact for the research that you're setting out to do. So they can help you prioritize and define your research questions. They can certainly help you guide you with what's feasible and practical. They can help you with data collection and analysis and interpretation and access to populations for your research. And they absolutely can help you with the communication and knowledge translation of your messages at the conclusion of your research. So what is a main message? And this is probably a little exercise that you could do with your research team. You want to be thinking of a clear, concise, audience-focused statement. And we have a tendency to maybe come up with 8 or 10 main messages from our research, and I would encourage you and challenge you to think about what are maybe the top 3, just to keep it really tight. And I'm not asking you here to simply restate your data, but to think about what the research results mean for people, why they're important, and if any action should be taken, what those actions might be, to make sure that your messages are tailored to your knowledge user needs and preferences. To reiterate here what I've said a little earlier is that the results of a single study can have different meaning for different knowledge users. So thinking through clearly what the implications of your research findings are for different knowledge users is an important exercise. Just a little joke to lighten things up here, but I like this because it reminds me that, you know, very few of us in our academic education have learned to speak in layman's terms, and we have a tendency, and particularly the new researchers, to want to speak in very complex ways about complex constructs and conditions, and we forget that we are, in doing so, we really are limiting how we can best share what we know. And so we need to not dumb things down, but speak more plainly. You know, many of the concepts and much of the work that we do in science is complicated and complex, and we need to think about how do we talk about this in a way that makes our research and our research findings accessible to a larger proportion of people. So keep it simple. You're just reviewing some principles of clear communication. To think again, this is partly related to your KT goal, but why are you communicating? Are you reporting? Are you asking? Are you informing? Are you trying to influence? Are you trying to explain something? What is it that you want to say, and how do you intend for the reader to use that information? That means you're going to need to know something about the readers, your knowledge users. Focus on the needs of the knowledge user, be effective and efficient, address their needs and their questions, and try to include only essential information. And so Distill, distill, distill. This is something that those of us who communicate often with government know that, a one-page brief sent to government often becomes a half page, and then as it moves up the food chain, maybe gets distilled to 2 or 3 sentences. We want to have some control over that process, so be really clear in what's the essential information that you want to share. And if you have difficulty with plain language writing, by all means, make sure that you have access to some resource or some support within your project or perhaps within your organization that can help you with good plain language writing practices. So just a learning checkpoint as a way of summing up the material that I have already covered with you. Let's consider which elements are universal components of KT, and we will probably hear tick off goals, audience, engagement, main messages, your KT strategies, how you will implement your KT strategies, how you're going to evaluate whether you had an impact and whether you met your KT goals, and how you have considered the resources needed to actualize your KT strategy. So really, all of the above are universal components of knowledge translation. Just a word here on the evidence for knowledge translation strategies. And here, I guess a caveat is what we know about effective KT strategies is a little dated. And here I rely on Richard Grohl and Jeremy Grimshaw's paper in The Lancet in 2003 as a summary of the synthesis of effective KT strategies for practitioner behavior change, and where they identified mostly effective strategies, strategies having mixed effectiveness, strategies having limited effectiveness, and those that were not included as a body of work that could be synthesized. So there are a range of things like the use of communities of practice and social media and arts-based knowledge translation and the effectiveness of using knowledge brokers that we are only just beginning to collect burgeoning evidence for in different instances. So as a caveat, what I would say is, when this research was being done that was summarized here in 2003, for one thing, it's a little bit dated, so I believe they included research evidence until the end of the 1990s in their review. And many of these research studies were randomized controlled trials, and the limitation of a randomized controlled trial in understanding process and how effective these strategies can be is that it doesn't take into account many of the contextual factors that are implicated in the success of behavior change or practice change. And I'm not going to go too far down that pathway, but just to say, as you're thinking of your KT strategies, I wouldn't put too much weight on what necessarily has been found effective or ineffective in different contexts. I don't think we're ever going to get to a point where we can say, for this type of population, for this KT goal, use this strategy, it's always effective. It's always going to be an iterative process, and I've listed here the KT strategies that are most common, at least in health settings, so that you can sort of run through them and discuss their relative merits for your particular project. So this takes us to the knowledge translation planning template. And I'm going to just run through a couple more slides with you to set the context for why I developed this template, and just really set the stage. And then we're going to change the screen and take you into the PDF so we can look at it more closely together. So this is the front page of the knowledge translation planning template, and it is available as a free download resource from my website. Let's take you through some of it. So the idea here actually came to me when I was asked on several occasions by my health research colleagues here at SickKids to help them develop a knowledge translation plan. And many of them came to me, with frustration saying, oh, for goodness sakes, CIHR is now asking for a KT plan. What on earth is that, and how do I even do it, and could you please help? And wanting to be collaborative, I said, sure, I'm happy to help. And the difficulty for me in helping them to develop a knowledge translation plan is that many of them were working in health areas that were really foreign to me. One scientist who came and said, I'm doing a research project on esophageal varices and I need to develop a KT plan. How do I do that? And of course I had to go and Google esophageal varices just to find out what they were. And I thought, there's got to be an easier way. And what I set out to do was to take the core components of good KT planning and put them on a template, a checklist, if you will, that would ensure that any group of people could sit down, use this as a discussion sheet, if you will, or a discussion guide, and start to build a KT plan by covering off all the KT elements that we think are essential, and then using what they have jotted down on this KT plan to develop a paragraph or two of prose, whatever seems to be appropriate for the KT activities that make sense for the project. So we really was designed to guide researchers and clinical educators and knowledge translation practitioners. So these are the people who really are on the rise as a profession, particularly in Canada, whose job it is to do knowledge translation for an organization, for a university, for a research institute. And so it's a new profession. And really, the guide is supposed to help you plan the process in a stepwise way. You got to think about this, 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 and this. As I mentioned at the outset of this webcast, it was developed really in response to our funders' requirements for knowledge translation plan to be embedded alongside the research proposal. You might be interested to look at a paper published in 2008 by Jacqueline Tetreault and her colleagues that looked at knowledge translation practices in research funding bodies worldwide. And interestingly for me, they were able to demonstrate that of, if I recall correctly, 20 or so research funders across the globe, about 3/4 of them were asking for knowledge translation plans. So this wasn't unique to the Canadian context. So the KT planning template is applicable to all health pillars, so basic to clinical to health services to population health. Some people say, well, as a basic scientist, I really don't think I need a KT plan, but if you really sit down and think about it, I would challenge that and say you will come up with some knowledge user audiences that go beyond your fellow academic in most instances. And even when we're just reaching out to other researchers, coming up with some new creative strategies that go beyond the journal article and the conference presentation might help you to be more impactful and move your research science along a little bit more quickly. It's also applicable to many sectors, so it isn't just health. It's mental health, it's education, it's social sciences, it's environmental sciences. We've included people in our training seminars here that come from the armed forces, that come from forestry and agriculture. So the range of application is really quite diverse. The KT strategies refer to the current state of the evidence base, as I mentioned, for KT strategies. And, this is not an evidence-based claim, but I believe that by using this template, one can develop effective KT activities for research practice and therefore end up with greater impact. So that's the plan. So for the educators amongst us, we like to think about educational objectives. So, remembering and understanding and applying and analyzing and evaluating and creating all of the sort of key elements of good learning. I've sort of mapped on the objectives of the KT planning template for the users. So at the end of the day, if you have gone through the template and engaged with the template and developed a KT plan, you will come away knowing the core components of KT planning. Everything from partner engagement to knowledge users and KT goals, the things that we've already covered. The template explains the steps one will follow and the rationale for implementing the KT plan pertaining to your particular project. And what's important to remember here is developing a KT plan for a project is not unlike coming up with the appropriate research methodology for a research question. It's really iterative. It's very specific. People have often asked me, can you give me a model? Can you give me an example of a good KT plan? And I'm really resistant about doing that, and the reason is I'd rather teach them to fish than give them a fish. So I would rather teach you the process of building a good KT plan, because KT plan for one project is going to look pretty different across projects. It's really difficult to say, here's a model KT plan, so keep that in mind. By applying the template, you'll be able to produce a KT plan for a specific project or a research endeavor. We outline in step-by-step fashion the core elements of each part of the plan. You get to think about what are the KT strategies and the KT approaches and the implementation approaches that are going to be best suited to my particular context and my project. And you create a KT plan that will guide your KT activities once you're successfully funded, and off you go. So as I mentioned a few slides back, the conceptual background for us in Canada was that we were being asked to develop these KT plans, and as the Tetra paper points out, this is common elsewhere in the world. Two-thirds of funders reviewed in their paper request a KT plan as part of a submission for research funding. Many promote active participation of knowledge users in their core research activities. And so we really developed this as a way to help people accomplish this behavior, this goal. For us, the KT Planning Template is an educational component of the Scientist Knowledge Translation Training Program that we run in Toronto, across Canada, and by invitation. So if you have an interest for your group of scientists, by all means, contact me. Of late, in 2011, we developed a week-long professional certificate for knowledge translation practitioners, and we offer that in Toronto. And so the KT Planning Template is really a big piece, a big component of demonstrating knowledge and skill accomplished in these two learning opportunities. To date, we've taught it to over, well, close to 1,500 participants, and then over 100 participants in our week-long course. So it's out there. And as I mentioned, it's available for free as a download. So as with anything else that goes out into the big wide world, people come back and say, well, can we use it? And the answer is yes, you can use it. You can disseminate it to whomever you like. Others have come back and asked me, can we adapt it? We want to tweak the language. We want to change the format a little bit so that it is more suited to our particular context. And the answer there is yes, you can adapt it as long as you cite the original piece. And there is I've tried to capture here at least some of the organizations that have taken on and developed an adaptation of the template for their purposes. There we go. There's a citation if you do develop. I mean, the thing I ask folks is if you want to use it, let me know, because that gives me my indicator of spread and utility. And if you want to develop an adaptation of the KT Planning Template, again, let me know. Cite the original piece, and if you would be willing to share your adaptation with me, then I, again, can keep track of where this is going and how it's being used. So the template is readily available on the web. The most recent version was just put out in 2013 this year. No other materials are required. And my recommendation really is that you develop this collaboratively with your research or your KT team. Really discussing this with people, maybe even including a couple of people around the table who aren't really familiar with your area of research, because oftentimes that outlier, that weak link in our network provides some interesting insights that can improve the work that we're doing. So just to point out that there are some references here for some of the work that I have spoken about on the earlier slides. And I'm going to ask Anne to switch us over to the PDF now so that I can walk you through what it actually looks like on each page. And we'll just wait for that to appear. Here we go. We're going to go up. So this is the front page of the template, and so this can print out. When you download it from the website, it comes to you as a PDF, and you can print it out in color or black and white. Again, the instructions are there, why this template was developed, that it can be used for non-research projects or research projects, and that it's universally applicable to areas beyond health. And so you're essentially going to sit down and guide a conversation through the different columns. And I believe I can use a pointer here and move this down. So project partners. I've broadened the language here, and I haven't put co-investigators, I haven't put research team, because I want you to think about your research team more broadly than probably you conceptualize it normally. Who are you bringing in that's not an academic or an investigator, that is part of perhaps the knowledge user audiences that are also going to participate as a project partner? And so think about whether that's researchers, consumers, the public, decision makers, someone from private sector or industry, research funding body, practitioners, etc. Who are you going to pull in? The next thing you want to think about is degree of partner engagement. So remember the story that we talked about a little bit earlier about the plumbers union and reducing scalds in young children. Well, once you've identified who your knowledge users are going to be and which of those knowledge users are actually going to be project partners, you want to think about when are you going to engage them. Remember, earlier seems to be better. Are you engaging them from idea formulation straight through? After you've conceptualized your research questions, you're going to bring people in and they'll be involved moving forward. Are you only going to involve people at the point of dissemination at the end of the project? And in some instances, that's valid. Are you going to continue to involve people beyond the life of the project? Is there a sustainability component here? So not all of your partners are going to be engaged at the same point in time, and that's okay. Some will be collaborators or project partners. Some will be end users or knowledge user audiences. Some members of your project team will be people hired to do specific activities. So there's sort of different kinds of people that you're looking to involve. You then want to be able to say something about what roles they're going to have in the research endeavor. What do the partners bring to the project? How are they going to assist with developing, implementing, or evaluating your KT plan? And so you want to be specific here in capturing their role. Some funders will ask for letters of support detailing what the partner actually brings, the validity of the research question to the partner's organization and their strategic mission, et cetera, resources that they might be bringing to the project. And this is really important, not just for you as sort of the project person, perhaps the primary investigator, but it's really critical in partnership building to be clear with project partners, knowledge users, what you're hoping to get out of their involvement in your research. What are you requesting that they bring to the table? My earlier example of working with the Canadian Association of Pediatric Health Centers, it was very clear. We want them to be a project partner to help us reach the intended knowledge user audience and to utilize the webinars format and services that they already have in place. Reduces the cost and the headache for us as a research team to partner with them, and it gives them material that they want to share with their knowledge users, so it serves a role for them. So think perhaps of a memorandum of understanding to create some clarity with your partners about what you are providing them and what you hope they are going to provide to you as a research project. What are they bringing to the table? And perhaps also including how you're going to interact with one another, how frequently, how much time you're asking of them, what resources you're asking of them, and so on and so forth. It's just good partnership building to do that. Next, you want to have a conversation about the KT expertise on the team. And this is really going to be very dependent on what kind of a project you're doing. Not all projects have very involved KT plans and KT activities, and that's okay. So, depending on what the needs are and the breadth of your KT activity, you want to consider, do we actually need a scientist with KT expertise as part of our team? Perhaps we are okay with a consultant that has KT expertise. Perhaps we want to hire a knowledge broker or a specialist within our budget. That's an allowable expense for us in Canada through CIHR and I think other funders, something to look into for your funders in the United States. Do you need KT supports within the organization, and what KT supports might be available to you? And here I'm saying the organization where you're sitting, those of you who are developing this plan, and the organizations that you're partnering with. And as I pointed out earlier, one of the strategic ways of developing, reasons for developing partnerships would be to seek out partners that leverage your KT activities. That's a good thing. What KT supports within partner organizations, and what KT supports that you may need to hire for specific tasks. If you're going to do some plain language writing and some one-page summaries at the end of the day, maybe you want to bring somebody on for a short period of the grant to help with that writing, to help with that communication, to help build linkages to media outlets. Those sorts of things would be important considerations. So now we turn here to the fifth column, and I seem to have lost my arrow. There it is. So who are your knowledge users? And this is where you are going to have a conversation about who's going to care about what we've discovered. And there's a list here. It's not, doesn't capture perhaps every potential audience, but will give you something to have a conversation about. Are we including researchers as knowledge users, health practitioners or providers, the public, media, patients and consumers, decision makers, policy makers, folks in the private sector, research funders, venture capitalists, voluntary health sector, or non-governmental organizations, some other audience that we haven't considered here. So have you included any of these on your research team, on your project team? That's something you need to be thinking about. So your project team, just to back up a little bit, your project team could be very likely more than just the investigative team, the academics. And your knowledge users could include academics, but could include other people. And if you think about it as a Venn diagram, they're sort of overlapping circles. Some might belong in both places. As you've identified your knowledge users, you then want to give some thought to what your main messages are going to be. And let's see if I can move this arrow, not wanting to move. There we go. What did you learn? What do you anticipate learning? So again, here, some people are using the KT planning template in the way it was conceived, which is to say at the time that they're thinking about their research and they're applying for research funding. And so honestly, you don't really know what you're going to find out, but you can anticipate. We will learn something about the best method for dealing with the needs of this particular population in this context. You want to sketch something out briefly. Probably more importantly, you want to talk about the process of how you will arrive at what the main messages will be for different knowledge user audiences with your research team, with your project team. And there's a place here for the sort of three primary knowledge user audiences for you to write in what messages you anticipate sharing. And again, think of your single most important things or your bottom line actionable messages. And you know what? Because this is prospective and you maybe have no idea what you're going to share, that's okay too. You can simply state and recognize that messages will emerge during the research through collaboration with your partners. For each of those audiences, knowledge user audiences that you've identified, you then want to think, okay, here's what I want to tell them. Why am I telling them? What's my KT goal? And so you have identified, let's say, practitioners as audience number one, and when you look at audience number one here, you're going to say to yourself, well, if practitioners are my first knowledge user audience, why am I sharing this information? Well, maybe I want to generate awareness, and you would tick that box. Or maybe I actually am ready with sufficient research, rigorous research evidence to go forward and try and change their practices, and you would tick that off. And so this is your opportunity for these three main knowledge user audiences to identify what your KT goal is. And remember, this is going to really drive your whole KT plan. At the end of the day, you're going to want to be asking yourself, Did we get there? And what KT strategies will you use to share those messages with these audiences? Again, we have given a nod to the Groeling-Grimshaw paper in terms of effectiveness of these strategies. Just remember that take this all with a grain of salt, I think, at this point, unless there is strong evidence for your knowledge user audience that's more recent for a particular strategy. And you might want to look at Cochrane or other reviews just to see what's the latest, greatest information about social media or about the use of opinion leaders or about decision support strategies. So down to the next page, we are now looking at KT process. So here's where you want to give some thought to when are we implementing these KT strategies and what's our sort of KT approach? What's our gestalt about knowledge translation for this research group or this project group? Is it appropriate to simply do the end of grant knowledge translation, so the things that we typically do at the completion of the research process, or would it really be beneficial to take an integrated knowledge translation approach where we're going to collaborate with knowledge users to shape the research process ongoingly? And more than likely, a lot of people will probably opt to do a bit of both. Turning your attention to knowledge translation, impact, and evaluation. Let me just say it is quite a challenge to put evaluation concepts and fit this into a template format. But what I really attempted to do here was to get you to think about where you wanted to have an impact as a start. So looking at 10A as the beginning section, when you think about where you want to have an impact by sharing your research knowledge, is it on healthcare and well-being? Is it on clinical practice? Is it on policies or systems? Or is it on research and knowledge base? And which one of these are you aiming for? That's a good place to start to help shape and maintain achievable KT plan and strategies. The next thing you want to be thinking about is how will you know if you achieved your KT goals? So this is that piece that is going to give you some information for the next project in terms of what gave us a good value for our effort. Was it good to do webinars? Was it good to do a plain language summary? Did the reminders actually work in this unit, in this hospital? Those are things you want to know. And so from a practical economic sense, it's important to ask this, but also if you can conceive of a nice, tight little evaluation, you can publish that as another publication. So another thing that we're always on the lookout for. So how will you know if you achieved it? Well, we can look at any number of reach indicators, usefulness indicators, use indicators. So for instance, if I develop a one-page summary and I send it out to a particular group of practitioners, that might seem like a really effective strategy to bring information in the face of people who could use it, who would be interested. What you don't really know just by targeted dissemination is, well, what did they do with that one-pager? Did they look at it? Did they throw it out? Did they share it? Did they show it to somebody and have a conversation? And so consider opportunities to circle back to at least a representative or a purposefully sampled group of people who were recipients of your KT strategy to find out what they did with it. Did they find it useful? Did they find it credible? What did they do with that? You may want to be measuring partnership and collaboration. A tool that I've found effective for doing that comes out of Ireland Public Health called the Partnership Evaluation Tool, and it's freely available on the web. You might be looking for practice change indicators or program and service indicators. So this is just really a bit of a cheat sheet of what are the things you should be considering in terms of looking for impacts of your KT strategies and what's going to make sense for this particular project. Some guiding questions for evaluation. that are really hard to sort of, it's hard to summarize the whole developmental evaluation process on a template, but just some questions to guide a conversation with your team as you build your KT plan. What kind of methods? Are they mixed methods? What perspective or skill set are you going to need? How do your stakeholders wish to receive the information? Some of the things that we've already considered. And coming on to the last page, what resources are you going to need to implement and realize your knowledge translation plan? Some budget items to consider, because at the end of the day, if you don't include them in your research proposal, you will not have the money to realize your KT plan. And so important to think right from a planful and project management perspective from the get-go, what is it we're going to need to budget for in order to make these things happen? Everything from open access journal, plain text writer, KT specialist or knowledge broker. If you have an intent of developing an infographic, you probably need to budget some money for a graphics person. Are you going to be needing some help on the evaluation side? Those folks who are interested in knowledge, in arts-based knowledge translation might be thinking about how are they going to mount their installation, how are they going to do their photo voice or their photography. Stuff to think about right at the beginning in a planful way. And then lastly, you want to consider how you're going to implement your KT strategies. So this is describing how you're going to, the processes and procedures that are going to be involved if you develop a guideline, if you develop a decision aid. It's great. Now you have a decision aid. How is that going to roll out with your targeted audience in that context, in that organization? How are you going to make that happen? This is the procedures piece, if you will, of your knowledge translation plan. So thinking, if your target is practice or behavior change, how are you going to ensure that the knowledge or the intervention you're transferring actually retains its quality and fidelity and sustainability? How are you going to use evidence-based implementation to roll out your particular intervention? So this is the conclusion of my part of the webcast, and I've taken you through the template. I hope you use it well and find it useful, and please absolutely feel free to communicate with me your experiences in using the template and any adaptations or usefulness that I can collect for my own impact indicator. So back over to you, Joanne, and thank you very much for everybody's attention.
Well, thank you so much, Melanie, for a very informative presentation today about KT planning, and thank you to everyone for participating in today's webcast. Before I forget, Melanie, I wanted to mention to you as part of your spread that the KT template is also located in our KT Strategies database that we launched in July. So you might want to know that that's happening and add that to the information for yourself.
Thank you.
And it looks like we don't have any time for questions today, but we do invite listeners to send questions to us by email to ktdrr@sedl.org, and we'll get those questions to Melanie. We also have a brief online evaluation form and would appreciate your input about the webcast. You will be able to include questions for Dr. Barwick in the evaluation as well. The link is on the last page of the PowerPoint file, and everyone who registered will also get email with a link to the evaluation form. We hope that you found today's session to be informative, and as a reminder, the webcast will be archived on the KTDRR's website. We also want to invite all NIDR grantees to register for the KTDRR's upcoming online conference on KT measurement, which takes place on October 29 through 31. Go to the conference website at www.ktdrr.org/conference. Before I go, I do want to ask Melanie if you have any final words for us this afternoon.
No, I think I suppose I would reiterate that I'm really interested in people's experience in using the template and their adaptations, and once again to feel free to use it and disseminate it.
Okay, that sounds great. I'm sure that people will be very interested after today's webcast to listen to your session at the upcoming conference. So once again, a big thank you from the staff at the Center on KTDRR to our presenter, Dr. Melanie Barwick. We also appreciate the support from NIDR to carry out the webcast and other center activities. On this final note, I'll conclude the webcast and invite you to participate in future events. Good afternoon.